So just a quick recap as we come back to immunizing agents. Our passive immunizing drugs include our antitoxins, immunoglobulins, snake and spider antivenoms. Our examples of those are for pit viper, coral snakes, black widow spiders. Those are antivenom. Hepatitis B immunoglobulin, our other immunoglobulins, and our rabies immunoglobulin. We have our ROGAM, which is a immunoglobulin that works when we have response to an Rh negative and Rh positive incompatibility potential. And we'll learn a lot more about that when we talk about maternity in the third semester. We also have our tetanus immunoglobulin, varicella, zoster immunoglobulin, just some more examples of our passive immunizing drugs. What are the indications for these immunizing agents? Well, for active immunization, this is our vaccine, right? They prevent infection caused by the bacterial toxins or the viruses. Now, they provide long-lasting or permanent immunity. And one of the things that we sometimes do as an indication isn't necessarily for the client or the patient that's getting the medication, but to create herd immunity for someone who cannot take an immunization. An example of that is our newborn infant for the pertussis or whooping cough. We want family members that are going to be in contact with that infant in the first 6 months to get their pertussis so that they don't expose the child, the newborn infant, to the whooping cough. So that's an example of herd immunity. There are other times that we would develop herd immunity to surround someone with love that they need so that they don't get the infection. And we show that love by those of us that are healthy, taking that vaccine and protecting as much as we can from the virus or bacteria. With our passive immunization, indications for that is when we've had a bite, right? Antitoxins, antivenoms, immunoglobulins, they minimize the effect of the poison by the venom of either spiders or snakes, and they provide that quick immunity before that person's immune system can make the antibodies, like if we have hepatitis B or rabies exposure. Now, our CDC, the Centers for Disease Control, and our Department of Health and Human Services have recommendations for adult and pediatric immunizations in the United States. They provide specific dosages and specific intervals for the immunizations. These change, so I never recommend that you try to memorize these. There's some guidelines that you will learn after you work with them a long time. But it is really important that you refer to the CDC website for the current recommendations because they do change. For example, we used to give 3 doses of the HPV, the Gardasil. Now we know we've had it, a long time now. Seems like just yesterday, but it's been quite a while. And we've had it longitudinally long enough for us to be able to say, if you get the HPV vaccination before the age of 15, you only need 2 doses. And so there are changes in current recommendations that are constantly being updated. So really important that you have the current information off of their website. They typically update that every January or February. So a vaccine or toxin or any of these could have a side effect. Just like any other medication, the biologicals could cause a serious reaction. The risk is low, but it can occur. One of the things that we need to remind our patients is that getting diphtheria, for example, or tetanus is actually relatively, is much more risk involved. It's relatively dangerous. And getting that disease is far riskier than the adverse effects or the potential for adverse effects from any of the vaccines. So they range from mild problems and very transient problems to serious and life-threatening. So we could have some minor effects like fever, maybe a rash, redness and swelling where the injection was actually given, maybe some itching, a little adenopathy or swollen lymph glands, maybe some tiredness or poor appetite. We don't have a list of moderate problems. They're actually pretty uncommon, but they could be some increased crying for a long period of time, maybe some staring. The more severe effects include a fever higher than 103, encephalitis, seizures or convulsions, and then, of course, anaphylactic reaction, dyspnea. These minor reactions are treated usually with acetaminophen or Tylenol and rest. If we have a serious or unusual reaction like a serum sickness or another unusual reaction, then we want to encourage our patient to seek medical help immediately. And we have a mechanism for reporting those serious or unusual reactions to the system. It's called the Vaccine Adverse Event Reporting System, or the VAERS. And what are nursing implications? Assessing the patient's health history, their medication history, their allergies, their pregnancy status is really important here. Assessing their status in terms of who lives with them as well, because if you have someone who's immune compromised living in the same house, we want to know that. Assess their previous reactions and responses to immunizations, and are there any contraindications, including immunosuppression of the individual, the patient you're going to give the immunization to, or someone that they might live with. Before giving any drug, again, remember to recheck your specific protocols for administration and the schedules for administration. Make sure you have the current CDC immunization schedule and criteria. Follow your manufacturer's guidelines, particularly with our immunoglobulins, our serums, our toxins, toxoids. Make sure that they have been stored properly, that you're administering them correctly, that you're using this appropriate route, and the site is the appropriate site. We want to encourage parents of young children to keep a journal of the child's immunization status with the dates of immunization and any reactions if they occur, because we're talking about prevention of infectious diseases worldwide. We think of our little corner of the world, but people are so mobile now and we move so frequently that it's really important for the parents of the child to have this. Sometimes a clinic or a healthcare facility may not be able to get a copy to them, and so it's important that they have that on hand. We want to educate our patients that if discomfort occurs at the injection site, they can apply warm compresses, they can give acetaminophen or Tylenol. We do not give aspirin to children. We want to monitor then for therapeutic responses as well as for adverse reactions. So as always, if you have questions, email, text, call, you can post in the discussion forum, and I will see you all soon.